Fracture healing. Healing of fracture occurs by callus formation. It depends on the following four clinical considerations. Traumatic, which means the changes in the normal state of the bone, that is the fracture, or the pathological, which means the diseased condition of a bone. And then complete or incomplete fractures, simple, comminuted, and compound fractures. The basic events in the healing of fracture are the same and they resemble the healing of skin wounds. In this picture, you can see the difference between the simple, comminuted, and open fractures. The primary union of fracture occurs by ends of fracture or approximated surgically by application of compression clamps or metal plates. These compression clamps or metal plates are nothing but the instruments used to join the two parts of the bone, two ends of the bone. And in the primary union of fractures, formation of medullary callus occurs. Though the patient is ambulatory early, they are slow healing. The secondary union, it occurs with the plaster casters which are used for the immobilization of the fracture. Secondary union is stated by three stages: procallus formation, osseous callus formation, and remodeling. In the procallus formation, there are four steps or stages occurring. The first one is the hematoma. In this, the ruptured blood vessels are formed or accumulated like a tissue in the fracture site, in the injury site, and then the fibrin clot also occurs in this. The second one is the inflammatory response. In this, exudates and macrophages and other neutrophils and polymorphs and fibrin clot are all present. In this inflammatory response, exudate means exudate is a liquid which contains the dead cells, the ruptured blood vessels, and the polymorphs and the macrophages, all those things. In this picture, you can see both the hematoma and the inflammatory response. And the hematoma is the blood vessels, ruptured blood vessels, and the small macrophages are present in this stage. This is the hematoma. This picture depicts the hematoma and the inflammatory response. And then the third one is the ingrowth of granulation tissue. In this, neovascularization occurs. Neovascularization means the formation of new blood vessels occur. The dead blood vessels are removed by the macrophages in the last stage, in the inflammatory response. Then the new blood vessels are acquired, and the proliferation of mesenchymal cells of the endosteum and periosteum occurs, so that the tissue growth will occur. So soft tissue will grow and it forms a callus like structure. Soft tissue callus is formed. You can see it in this picture. This is the ingrowth of granulation tissue. In this picture you can see the new blood vessels are formed and the new soft tissue callus is formed. And the fourth one is the callus composed of oven, bone, and cartilage. This occurs in the first few days, and collagen formation, collagen deposit occurs in this. After that, the osteoid forms. Osteoid becomes lamellated and it forms the oven bone callus, which may and this shows the callus is a spindle shaped, or it may be fusiform also. See, in this picture you can see the callus formation on both the sides. The oven bone callus is formed, and it may be the cartilage is formed in special cases when the fracture is immobilized more. Example, in rib fractures, in rib fractures you can see the formation of cartilage in this callus. And this type of callus is called as the provisional callus or procallus. And this provisional callus or procallus is of three types: external, intermediate, and internal. And then the second stage in secondary union is osseous callus formation. In this osseous callus formation, The lamellar bone forms, and then new blood vessels also forms. New blood vessels, osteoblastos, all those are forms with the, and the lamellar bone forms with the central Havasan system also. You can see in this picture the osseous callus formation with the new blood vessels. See, osteoblasts are deposited. These green color dots are osteoblastos, and that violet color is the callus formation, and the Havasan system is also formed. And then the remodeling. In the remodeling, there is osteoplastic laying as well as osteoclastic removal. That means the older cells are destroyed and the new cells are brought more. And in this remodeling, the united bones and bone ends end, so that it appears like a normal bone. The fracture site will be destroyed. This is the last stage of healing of fracture, remodeling, and it is the new bone marrow cavity also formed in the internal callus, and the external callus disappears, and the intermediate callus gives rise to new cells. So this is the remodeling, and this is the final stage of the fracture healing. And then the complications of fracture healing. There are three complications. First one is the fibrous union. In this, instead of osseous union, fibrous union forms because the immobilization is not done properly. So that the instead of osseous union, fibrous union occurs. And occasionally a false joint may also develop at the fracture site, which is called as pseudo-orthosis. Again, it becomes more complicated. This is the fibrous union. And then the non-union, in this soft tissues interposed between the ends. Actually, soft tissue must be present in the center, but in the non-union the soft tissue will be present between the ends, so that the ends will not be united properly. And then the delayed union, in this it may be because of the delayed wound healing, which may be due to infection, inadequate blood supply, poor nutrition, movement, and old age. So these are the complications of fracture healing.